The World Health Organization, WHO, estimates that 7 million adolescent girls give birth before the age of 18 years every year. In addition, 150,000 young people aged 10 to 19 years are infected with HIV, according to the 2020 data.
When I was young, I never used to know that I can use contraceptives to prevent myself from pregnancy. And also I never used to know that I can use to prevent myself from getting HIV and AIDS.
For the past 3 years, the Regional Psychosocial Support Initiative, REPSI, and its partners, Kenya Orphan Rural Development Program, CORDIP, and Kibra Community Self-Help Group, KICOSHEP, have been implementing a project dubbed Improving HIV Outcomes through Psychosocial Support Skills that enhance HIV prevention and access to services in Kibra, Nairobi City, and Matayos, Busia County. The project is meant to help adolescents build psychosocial skills to enhance uptake and use of sexual and reproductive health knowledge and services through emotional and social well-being.
Using our psychosocial support skill tool, we support teachers to initiate clubs. During the clubs, the teacher facilitates the skills because they are the one who spend a lot of time with those children.
The psychosocial club has played a role in trying to link children, their parents, and the teachers. Some of those learners had low self-esteem, but through that free participation in club, it has made most of the learners enjoy coming to school because there is something they can feel, they can now feel at home.
Through adolescent clubs providing knowledge on HIV, treatment adherence, and psychosocial skills, adolescents are able to nurture their self-definition and inculcate sound values and virtues in their lives towards better health connection.
I have been a member of psychosocial club, and from this club I have learned more, especially as an individual, and even our teachers have taught us many, like how to protect yourself.
Mostly after the training, we actually tried to educate our fellow teachers and about areas and the challenges the adolescents faces and help them develop to achieve their goals.
If the club was not there, these cases of teenage pregnancies, I think they will have moved to a very high level, but because of the club we have been able to reduce that.
So the moment I got the training, my attitude changed towards the learner, towards everything, and also towards life. Once I understand the background of that child who is trying to be a little bit difficult, I'll get a way of managing that child.
I normally have class every Saturday at noon with these children, and I have the manual for psychosocial skills. So I do teach them, and after that, they can now open, even that shyness is not there.
That issue of communication which is blocked between teacher and the child and the parent and the child is opening up. And that for me was like, this is a great thing to happen.
By using socio-ecological approach, the project involves parents and caregivers into conversations that include reflection and discussions. This way, they are able to understand their own lives and find safer ways to talk to their children about sexual and reproductive health and rights.
Mara nyingi sana imenisaidia hasa mtu kama mimi. Kuna mtoto ambaye nusura akatae masomo. Lakini kwa sababu nilikuwa ninahusika kwa vikao kama hivi, niliona kwamba huyu mtoto alifunguka mawazo yake na akaniambia kile ambacho kinamsumbua. Saizi ako kidato cha 3. Inasaidia sana.
Msichana wangu mkubwa wakati alibelehe alisumbua sana, na tunaitwa boarding school, hajafika huko. Tukazungumuza, so she opened up, akatuambia hata ako na boyfriend mwenye anamwambia ukikuja nitakupatia pesa. Tukazungumuza, akakubali hiyo tabia hatafanya na akawacha kabisa. Sasa kuanzia hapo akasoma akamaliza shule.
Kufundisha watoto wetu nimepata njia moja au nyingine jinsi nitakapokaa na mtoto wangu ama na watoto wangu, familia yangu kwa jumla. Ndipoza utajua shida mtoto ako nayo na jinsi utakapoitatua kama mzazi. Lazima umuhatarishe ya kwamba ngono kuna zile hatari inatokana nayo.
So just to be measurable, na waambie mtoto exactly what you don't want. Don't just beat about the bush.
We want to bring our children to the level where we have brought adults, that the children can understand the truth about sex, truth about reproductive health, the stages of development, so that they know when to engage in sex, and when they do, it should be safe sex.
Nobody used to tell me this. According to my mom, never used to say anything. My people from home, they never used to say anything. So you're getting the information from outsiders.
Oh, vizuri, mmekuja wote. Ndio.
And that's why we have come with this program of Wasiosoma thing, so that we can enlighten the small youth.
If they are given the psychosocial support, we can save them from those problems, and we can save them from acquiring HIV and AIDS. Since it addresses a number of things, the stigma these adolescents have.
Ningependelea mafundisho yaendelee ili tuelimishe wamama zaidi uko nje. Wamama wazidi kupata mafundisho bora.
They want to know more, to learn more. So if we can expand the project and reach out to many, we can be able to help and save a lot of young people.